from your position at Parkland Health, what's your number one priority when it comes to data and analytics?
That's a great question. And our primary goal as a services, as a service line that provides a service to the organization is we want to make sure that we've got our systems available. Uptime is very, very key. So, making sure that we have resiliency built within our data infrastructure to make sure that, the information that provides decision-making to our clinicians and business operation leaders, it has to be available. They can't go to need to make a decision and then, hey, the data is not there. So, I'd say having the system uptime is very, very key. And then the second, probably 1B, is making sure that data quality is very high. That's one thing that we just do not bend our standards on, is data quality, because that builds trust within your business consumers to say, hey, when I reach out and grab that report to look up this information, or I open the dashboard and apply these filters, I don't have to guess whether those numbers that are represented in that report or dashboard are correct. They trust that. And one of the reasons we've been able to build that kind of trust with our business stakeholders is that we didn't bend when it comes to data quality. So we scrutinize all of our products very heavily. We have an internal validation before it ever goes to the customer, and then they perform a customer validation, and then it's turned on and live in production. So one of the reasons why we do that is to, once again, just build that trust amongst our key stakeholders. And it's been very successful. I mean, several of the organizations I've been at prior to Parkland, during my consulting days, that was something very key. Can we trust that number that's represented on the screen or in that report? Mm-hmm. And it's not always something that clinicians, when they're making a decision, it's going to impact a patient. It may impact an outcome. And they're certainly going to scrutinize whatever they're looking at with heavy hands, and they should. And they do. And so, that's one of the things that, we've been able to somewhat avoid, because we have placed such an emphasis on quality and validation.
Interesting. Okay. So you talked about the success that you're having at Parkland, and I think you hit on it previously around healthcare crossing that chasm into data and analytics. So I think from your perspective, how are you seeing data analytics transform from a secondary business focus to kind of like a core function of the organization?
Yeah, and I think it was already happening prior to the pandemic. In several areas, not several, but in most of the areas of Parkland, we were starting to get that buy-in from our business stakeholders that says, hey, we've got a real valuable asset in our data program here. Let's start using it. Because, when I arrived at Parkland, we had a large queue of operational reporting that really wasn't driving a lot of strategy. But, shortly after we started kind of promoting the program and really getting out there and engaging with the business and showing them some of the tools and how they could access it and engaging in our data literacy program and things of that nature, you started to see the appetite for data become much more pronounced. And we somewhat became a victim of our own success at that point, because, we had a queue of like 200 requests that suddenly skyrocketed, to almost double that. And then, but not only that, it was the request for dashboards or more complicated things that we were seeing that kind of signaled to us that, hey, this organization is really, really dependent upon the products that we're providing. And so, we leaned into that. We took on the discomfort of having to prioritize and come up with a scoring mechanism so that we were actually, our teams were focused on what was going to provide the best impact to the enterprise as a whole, and not just, really focusing on who was yelling the loudest or, something like that. So we started to see that prior to the pandemic, but then when the pandemic hit, it really, it exponentially increased our popularity, for lack of a better term. And we were pulled into meetings with our CEO and our CFO and some of the executives that really were taking the information that we were providing and then reporting back to our board of managers, our county, to say, mm-hmm. Hey, this is what we're seeing. We had to operationalize things very, very rapidly. That, in typical my consulting days, I'd see, it would take 3 to 4 weeks, maybe a couple of months to produce some of these products, we were
Mhm.
doing this in days and weeks. And, and I think part of the reason why we were able to do that is not just because of the maturity we had in our team, but we had that engagement with the business.
Yeah.
And they understood that, for us to really design something that was going to provide benefit and value, they had to be at the side designing it with us, testing it, maybe reiterating some of the design concepts. And then, all of that stuff had to happen before we would deploy the product. But the outcome was that we were able to meet some of the demands early on in the pandemic very, very quickly. I think we had our dashboard for the command center, set up within a matter of a week or so, with live connections, so it was in real time within 2 weeks. So, I mean, those types of agility just aren't typical. And, some of our colleagues that we have partnered with in the industry were helping us. We were collaborating as some groups of other, more mature healthcare organizations, trying to solve, hey, what operationally is going to improve the lives of our physicians? Because nobody knew.
Yeah.
We were fortunate enough to have a partner in the Northwest in Seattle that, they were seeing the earlier phases, and so they were able to kind of give my team some ideas on what do we need to be looking at. And so we proposed those ideas to our clinical leaders who, in fact, said, yeah, these are metrics that we need to be tracking too. And there are things like, what's our presumed rate? How many people were arriving at our hospital with that were presumed to have COVID? How many positives? Early on, if you remember, in the pandemic, testing kits were a real big. We were in real short supply, so we had to change things up constantly based on what lab test was we had available or we had supplies of. And then we were also asked to track things that we typically didn't track, like staffing or beds or ventilators and things of that nature, that we knew that these other healthcare systems that were a little earlier in the pandemic response, that they were saying these are the things that were important to their leaders. And so we were able to provide that to our colleagues. And I think it really helped out in, maybe not, I don't think it changed the course of what we saw from an outcome, a volume perspective. But what I do think it did is it gave our leaders a little bit of sense of, hey, we know what's coming to hit us and we could better prepare. And so, even if it was just a day or two, we could start seeing patterns in our arrival rates. And the other thing that we had to do with the vaccines is deploy mobile technologies to get out and start vaccinating in massive quantities. And that required, a heavy data involvement, because, we had to segment out our population so that we could, engage with our 1As and 1Bs and, and really go through the stages of rolling out the vaccine that happened. And we, I'm proud to say that we were at the forefront of all of those. And I think that's just a microcosm of what we're going to see more and more and more happen within the healthcare industry is, how do we get out there and engage with our population, give them accurate information of where they can go to get testing or treatment or something like that. And, and that's exciting. I think, population health has always been a buzzword and something that, has been tossed around in our industry for years. But I think we're right now at the precipice of really pushing that forward and doing something impactful